Welcome to Better Health Now, your go-to source for health and wellness advice. In this video, we will be discussing how to naturally and effectively lower prolactin levels. If you're struggling with high prolactin levels, you're not alone. It can lead to a range of symptoms, including irregular periods, decreased libido, and even infertility. But don't worry, there are natural ways to manage your prolactin levels and improve your overall health. By the end of this video, you'll have a clear understanding of what prolactin is, why it's important to regulate its levels, and some simple yet effective tips to lower prolactin levels naturally and fast. If you find this content helpful, don't forget to subscribe to our channel for more informative videos on health and wellness. What is prolactin levels? Prolactin is a hormone that is primarily responsible for lactation in females, but it also has other functions in both males and females. Prolactin levels refer to the amount of this hormone that is present in the blood at any given time. In females, prolactin levels naturally rise during pregnancy and breastfeeding to help produce milk. In males and females, prolactin can also play a role in regulating the immune system, metabolism, and reproductive function. Abnormal prolactin levels can indicate a variety of conditions, including pituitary tumors, thyroid disorders, and certain medications. High prolactin levels can also cause symptoms such as breast milk production, in non-pregnant or breastfeeding individuals, irregular periods, and decreased libido. How to lower prolactin levels naturally and fast. If you have high prolactin levels, it is important to speak with your healthcare provider to determine the underlying cause and receive appropriate treatment. However, there are a few natural ways that help lower prolactin levels. Number 1. Manage stress. Stress can increase prolactin levels in the body by activating the hypothalamus-pituitary-adrenal (HPA) axis. When a person is under stress, the hypothalamus releases corticotropin-releasing hormone (CRH), which stimulates the pituitary gland to release adrenocorticotropic hormone (ACTH). ACTH, in turn, stimulates the adrenal glands to release cortisol, which is a stress hormone. Cortisol can indirectly increase prolactin levels by reducing the activity of dopamine, a neurotransmitter that normally inhibits prolactin release. When cortisol reduces dopamine activity, it can lead to an increase in prolactin levels. In addition, stress can directly stimulate the release of prolactin by activating the pituitary gland. This is because stress can cause the release of certain hormones and neuropeptides, such as serotonin and neuropeptide Y, that stimulate prolactin secretion. Overall, chronic stress can lead to sustained high levels of cortisol and prolactin, which can negatively impact overall health and wellness. This is why it is important to find ways to manage stress effectively to maintain hormonal balance and reduce the risk of health problems associated with high prolactin levels. Number 2. Getting enough sleep. Getting enough sleep is essential for hormonal balance and can help lower prolactin levels in the body. This is because prolactin secretion is regulated by the body's circadian rhythms, which are influenced by sleep-wake cycles. During sleep, the body undergoes a series of hormonal changes that help regulate the release of various hormones, including prolactin. Research has shown that sleep deprivation can disrupt these hormonal changes, leading to an increase in prolactin levels. More so, the hormone melatonin, which is released during sleep, can help regulate prolactin secretion. Melatonin has been shown to inhibit prolactin release by acting on the hypothalamus and pituitary gland. Therefore, getting enough quality sleep each night can help regulate the body's hormonal balance, including prolactin levels. Aim for 7 to 8 hours of sleep per night, and try to establish a regular sleep routine to help regulate your circadian rhythms. Avoiding electronic devices before bed and creating a relaxing sleep environment can also help improve sleep quality and reduce stress, which can further help lower prolactin levels. Number 3. Avoid high-protein meals. Avoiding high-protein meals may help lower prolactin levels in the body because protein consumption can stimulate the release of certain amino acids, such as tyrosine and phenylalanine, which are precursors to dopamine. Dopamine is a neurotransmitter that inhibits prolactin release, so increasing dopamine levels can help lower prolactin levels. However, consuming too much protein can actually have the opposite effect and increase prolactin levels. This is because high-protein meals can stimulate the release of the hormone gastrin, which in turn stimulates the release of prolactin. Therefore, to lower prolactin levels, it may be beneficial to limit high-protein meals and instead focus on consuming a balanced diet with a moderate amount of protein. This can help ensure that the body is able to produce dopamine and other neurotransmitters necessary for hormonal balance, while also avoiding excessive protein intake that can lead to increased prolactin levels. It is important to note that the optimal amount of protein intake can vary depending on an individual's age, sex, weight, and physical activity level. It is best to consult with a healthcare provider or registered dietitian to determine the appropriate amount of protein intake for your specific needs. Number 4. Medications. Certain medications can increase prolactin levels in the body by interfering with the normal regulation of prolactin secretion. These medications can include antipsychotics. Some antipsychotic medications, such as risperidone and haloperidol, can increase prolactin levels by blocking dopamine receptors in the brain. This can lead to an increase in prolactin secretion and can cause symptoms such as galactorrhea, breast milk production, menstrual irregularities, and decreased libido. Antidepressants. Some antidepressant medications, such as selective serotonin reuptake inhibitors, SSRIs, and tricyclic antidepressants, TCAs, can increase prolactin levels by blocking serotonin and/or norepinephrine reuptake in the brain. This can lead to an increase in prolactin secretion and can cause symptoms such as galactorrhea and sexual dysfunction. Antihypertensives. Some antihypertensive medications, such as verapamil and methyldopa, can increase prolactin levels by stimulating the release of prolactin from the pituitary gland. Hormonal therapies. Some hormonal therapies, such as estrogen and some forms of hormonal contraception, can increase prolactin levels by stimulating the pituitary gland. This can lead to an increase in prolactin secretion and can cause symptoms such as galactorrhea and menstrual irregularities. Number 5. Herbal supplements. Some herbs have been found to have potential benefits for hormone regulation. Here are some examples. Vitex sonus castus, also known as chasteberry. Vitex sonus castus is a popular herbal supplement for balancing hormone levels. It has been shown to help regulate prolactin levels by acting on the hypothalamus and pituitary gland, which are responsible for regulating hormone production in the body. Mucuna pruriens. This herb is commonly used in Ayurvedic medicine and is believed to help support healthy hormone production. Mucuna pruriens contains L-dopa, a precursor to dopamine, which can help regulate prolactin levels by inhibiting its release from the pituitary gland. Ashwagandha. Ashwagandha is an adaptogenic herb that has been traditionally used for its anti-stress and anti-anxiety properties. It has been found to help regulate hormone levels by supporting the HPA axis and reducing cortisol levels, which may indirectly help to lower prolactin levels. It is important to note that herbal supplements should not be used as a replacement for conventional medical treatment for high prolactin levels. If you suspect that you have high prolactin levels, it is important to consult with a healthcare provider for proper diagnosis and treatment. Your healthcare provider can advise you on the appropriate use of herbal supplements and monitor your hormone levels to ensure that they are safe and effective for you. Thank you for watching the video to the end. Please, if you love our video, click the like button, give us a thumb up, subscribe, share and drop a comment on the video you like to see next.